What the Health. And so we wanted to lead this session today by kind of starting with some level setting. And then the way we're trying to organize this is we are thinking about the values that Nikki shared with us this morning in our group agreements. And so there is this really cheesy book called The 1 Minute Manager. And basically what they talk about in The 1 Minute Manager is that if you are only talking about problems and you don't mention solutions, you're just complaining. And so what we want to do here is complain productively. So we want to frame our challenges and then paint a picture for what we'd like to see differently. And so that's what I'm going to be pushing us to, even when we get into some of the challenges, like we're going to really be trying to push you to. So what would you like to see different? And I want to make sure that when we say that, that doesn't necessarily mean that you have to know how you get there, but at least paint the vision, because part of what tomorrow and the days after tomorrow can be is about how do we figure out how to get there. But it's important for us to know what we want to be different, otherwise we're just complaining. Is that okay with everyone? So we're going to complain productively for the next 2 hours in hopes that we're going to be able to address some of the health challenges around homelessness. And so we wanted to start by just kind of, thinking about homelessness as a public health crisis, because I know that sometimes that's thrown out there, and we wanted to make sure that we were all kind of on the same page about that. So MK does a lot of work in this area as well, and I've been talking for a few minutes now, so we're going to just kind of volley back and forth for this first part, and then we want to get everybody else involved. The other ground rule that we wanted to just talk about is we really want to make space for people in here to be heard, and so we want to hear from you, sometimes multiple times, because we're going to be here for 2 hours. But we also want, if you've spoken before and somebody else wants to speak who hasn't, we want to hear from them first, just so that we're getting an opportunity to hear from many voices. So what I'm going to ask is that when you raise your hand, you can keep track in your head of how many times you've spoken. And when you raise your hand, can you just put up, this is your second, this is your third, just give me a number, so I can kind of keep track of, if you're the first, this is your first time speaking, put up a 1, so that way I know to call on you before I call on somebody who's raising their hand to speak for the first time. Is that okay with everyone? Okay, awesome. Okay, let's talk about homelessness as a public health crisis.
Yeah, I mean, that is the place to start. So, yes, we all know that homelessness is a public health crisis, and it includes so many different aspects of care, of space, of things, and how to start addressing it. I work in healthcare outreach and delivery, so the things I think about are how do we decrease barriers to physical health care, mental health care, substance disorder care, and that's one of the things I hope we can talk about today. What does the ideal service look like? And short term, for right now, tomorrow, how do we start to do better? Long term, what are we aiming towards? And how do we get there?
Absolutely, and I work in public health, so I'm always thinking about what are our policies in place? What are those bigger structural barriers that we need to be thinking about? And so we're always thinking about the long-term vision of what system do we want to build? Because we know that the current system is racist and classist and has tons of barriers and is not designed. People often say systems are perfectly designed to get the outcomes they're currently getting. So if we look around at what we see right now, the system is perfectly designed to continue doing this. So we really need to think about system design in terms of what do we want to see different, what is the long-term vision for us, and then from there we can figure out how we get there. So I primarily work in the policy space of public health, even though I am an epidemiologist by training. So I'm always thinking about what do we know and then what should we be doing about it. And just, homelessness is a public health crisis for 2 reasons, right? Number 1, shelter should be a human right. We understand that when people are unsheltered, it is a risk to our physical and mental and emotional health. And then also there are the health consequences that come from experiencing homelessness, especially when you're also not being protected. We've heard from our panelists, right, about all of the ways that their personhood and their dignity and their humanity is assaulted on a regular basis. And so it's we shouldn't have people not properly housed, and then not being properly housed creates a whole host of other problems, which we saw just become much worse during the pandemic.
Yeah, problems in death, early death. People are dying at earlier rates if they live outside.
Literally, because and as much as people think, oh, California, that's the perfect place to live, no, it's not. It's hot, and then it's cold. Yeah. And humans are very, very, very you may think of 60 degrees compared to living in Michigan and it's -12 as being, you know, nice climate, but just a few degrees, if you're sleeping in it, if you're around it all the time, can really have a big impact on your health. So it's not cool. That's an understatement.
And just one more step further, criminalization of people who are living outside is also a public health crisis.
Absolutely.
So continuously moving people around, continuously displacing, leads to worse health outcomes, leads to death, lack of sleep, mental health, substance use, et cetera, et cetera. So that is also a part of the continuum.
Absolutely.
So,
Yeah.
that's it.
That's our intro.
Yeah.
If anybody has anything they want to add to our intro, just in terms of framing, you are welcome to do so now. But if not, we want to jump into some challenges.
For sure.
Anyone have anything they wanted to add to the frame? Okay. So when we're thinking about challenges, right, there are lots of topics that we want to bring up. And part of what we want to do is think about what seem to be the major challenges there, and then what would we want to see happen differently. And so this is really our brainstorming opportunity to think about what are we seeing, what are major problems, and I really want you to think, if you have lived experience, please feel free to share if you feel comfortable. If you have observational experience, please feel free to share. We want to be respectful of everybody coming from different places, and being able to share your truth. And be able to then talk about what we want to see different. Yep.
Substance abuse. First of all, I give up. I'm going to get a beer. I give up. I'm going to get a beer. Forget it.
Okay, so our first one is substance abuse. We want to and so I give up. I want to get a beer. I want to go get a beer. Okay. So what would you want to see be different?
That's a good question.
I'll put you on the spot, Mr. Andrew, right? What would you want to see be different? What do you see as the challenges? Right? I mean, because, I'm thinking about the panel, right? And some of what the panelists said were the ways in which, when you're experiencing homelessness, you don't get the same dignity as everybody else. So there's substance use, and there's, we kind of glamorize it, right? If you're middle class and housed, it's, ooh, I had a rough day, let's have a glass of wine. I'm living on the street, and I've had a rough day and I want a beer. How is that different? And is that the same thing as substance abuse? So let's separate these out, because I think there's some nuance that needs to be applied here. We seem to overly police the lives of people experiencing homelessness when people who are housed are doing the same thing and don't get that judgment. So I've had a rough day, I want a beer because I didn't go to Lowe's earlier today and get food. Instead, I tried to get out and they told me there wasn't any, and now I want a beer. Is that substance abuse, or is that what millions of Americans do every day, but because they're housed, no one cares?
Yeah, the same thing.
And then where is the substance abuse piece of it? Because I think we should separate those two issues out.
They're both substance abuse.
You think they're both substance abuse? Okay, say more.
Just giving up, man. I try to get housing, try to get this, try to get that. They won't even answer the phone. Folks won't even answer the phone. And then I go in person. Oh, we're not seeing anybody in person.
So the non-response.
You right there.
I'm hearing non-response. I see Captain with the hand back here.
Yeah, I was gonna say, when I used to be out there, they would call people like you a nuisance, but just been homeless, because back there, homeless dear, what is a nuisance? People just like that, well, I don't even know what the word means.
So they were just referring to you as a nuisance just for being around.
Being homeless, you got any kind of capping gear, you're a nuisance, you don't supposed to have.
Yeah.
And what would you like to see differently, Captain?
They don't let me call people no names like that, but I don't even know what that means. I laughed at him. What's a nuisance? He didn't even know himself. But don't change the fact they're gonna call people there, and some people get mad and call for them. They don't wanna know, they don't wanna be called no name, but they don't know nothing about. You know, some girls start crying, she called him and she'll lose it. They don't let them cry about that, they don't let them do that.
So would you describe that as like verbal abuse from people in the community to you?
Yeah, the police came there on them horses.
So this is now police abuse.
Yeah.
Okay, all right, so we'll note that. So what would you want to see different?
But they just have respect for people.
Okay.
But they don't got no respect for the homeless person. They want the homeless person in the city of Sacramento.
Okay. All right,
They want to get rid of all of us.
so I appreciate that. So we're talking about like the institutions, right? And the people who are supposed to be serving folks not having respect. And I also heard like system non-response as one of the concerns as well that Mr. Ed brought up, right? That like I go, I'm trying to no housing, there's nothing available for me, and I kind of want to give up, right? And I'm giving up because I'm trying and it's not being successful.
There ain't nothing out there. There ain't nothing out there.
Okay.
So you gotta go on the waiting list, you gotta wait until something come up.
Yeah.
It be like 2 to 5 years.
What about some other challenges with like we started with substance use, and I don't know if we got to, are there available services?
Yes, no.
Well, I think one of the reasons for people using substances is like isolation, and we've seen with the pandemic, you know, the substance abuse navigators were saying that like so many more people were addicted to drugs. So I think maybe this like the time of isolation and lack of socialization, it can be filled with like mentors or something like that to help them overcome the substance abuse.
Okay.
Or socialization or mentorship.
Okay, so we're saying isolation as it relates to like our mental health, and then I'm hearing you propose as one of the possible things we'd like to see different, being people have actual opportunities to engage with one another. So,
Like Medicaid. Like we have a health insurance broker that comes to our respite centers, and he was telling us that when people come in, they have like when they hear the word broker, and they kind of have a mistrust, and they don't want to trust them, even though he's just educating them about their eligibility for Medicaid and Medi-Cal and county health services. So I think more education and like really helping them understand that most of them are eligible for Medicaid, and they need to utilize that.
okay, I see him getting some notes down for us as well. Did I see some other hands?
Education from someone we can trust,
Okay, so
not from just somebody.
what might
Up
that
in
look like,
office.
Mr. Ed?
Huh?
What might that look like? Who are people that we can trust?
Our friends, somebody sleeping next to me,
Okay.
I would trust them more. Then I trust that person in the office, sitting in the office that I just came to.
Okay. That's
Because I've been lied to so many times, still being lied to.
And politicians.
Can you say that again?
And politicians.
Oh, and politicians. Okay.
I recently spent 13 hours in the emergency room at Kaiser, and what I observed were unsheltered people being brought in and treated, and then maybe a 5-minute conversation with the social worker that people tended to, they were sort of asked, well, can I help you with anything? And they tended to say no, and then that was the end of it. And then I think they just walked out to be back on the street. So that's an obvious system failure to me, because whatever health problem that brought them in is not going to get fixed.
So missed opportunities.
Well, and the missed opportunity, lack of connection with housing, you know, these siloed service, you know.
And so am I hearing you say that one of the things you want to see happen there is a connection to services?
Yes.
And a
in
connection to housing, if housing is available, or other, continuation of care?
Yes, I don't know what the solution is, but obviously.
That's okay, you don't have to fill in the details,
Yeah.
we're just trying to paint the
Right.
vision. So
Yeah.
welcome to the people who came in. What we're doing right now is we're talking about, just so that you have a little frame, we're talking about challenges, especially as it relates to health. And what we're asking is, in the spirit of some of the ground rules that Nikki set for us this morning, we're saying we want to complain productively. So if you bring up a challenge, we want to think about, even if you don't know how to make it happen, what would you want to see different? So that's kind of why I'm probing people back and forth when they're bringing up a challenge of like, so does it sound like what you would like to see instead is this? So if you have health challenges, we talked about homelessness as a public health issue, in both that people should be housed because being unsheltered deteriorates our health and then also makes health conditions worse. And so it's this revolving cycle of not being housed making us even sicker, and then you're not housed, so it continues on. So that's where we are, so welcome to the space. I haven't heard from a lot of folks on this side of the room, so I'd love to.
Yeah, so I think ultimately what I really want to see is just people being able to have access to like a primary care physician or something like that. Because one of the issues is like that continuation of care, like not being able to see him regularly. Because I know like health prevention is a really big thing. Like, one of the reasons why people have a difficult time and end up on the streets is because like there are these really like taxing health issues. Like I think one of the panelists mentioned a tumor, and just the amount of medical bills just put her out on the streets. And so I think ultimately like what I would like to see as like the ideal is like people having access to like that primary care, that prevention medicine, so that they don't get to that point. Like you can catch a tumor like way before it gets to like a later stage. And so one of the I guess like a shorter term solution I was thinking of in terms of your issue of like substance use too was like, and this can go into like mental health too, like I think support groups. But the issue with support groups, I think, is like just getting that information out. So I don't know, also working on like outreach too. Back to my point about like primary care, like access to primary care medicine. I don't know what kind of healthcare system that would be, because we can look at other countries like the United Kingdom, and they have like free healthcare for everyone, but then there's the issue of like waiting in lines. Like everyone has to wait in a line, and it's like if I'm having a health issue, I don't have that time to wait in line.
Right.
So like I don't know what kind of healthcare system that would be, but I mean like if we knew, like we wouldn't be having this issue. But yeah, I don't know, like whether it's like healthcare, free healthcare for all, or like there are those trade-offs.
Yeah, so like what I heard you, and you
Sorry, there are a lot of ideas in there.
No, they was wrapped up in there. Well, I think what I was hearing in the end was you talking about the efficiency. So it's not just do you have healthcare, but is it efficiently provided so that I don't have to spend an entire day trying to get care, so that I'm not waiting 6 months when I needed the care beforehand. Is the system functional? So I put that up there with the system non-response, or the system being efficiently operating. Thank you for that. Other healthcare challenges?
So from the other side, I've done some consulting and have had a really hard time getting people. I'm a psychiatrist, and so my role would be as a therapist. I have a really hard time getting people to even see me the first time, and then after they see me the first time, they don't want to come back the second time. And maybe I'm a terrible therapist, except in my private practice, I don't have that problem. So I would like to know what we can do differently to make mental health care feel more user-friendly or something, so that we actually have the services people would take advantage of it.
Yeah.
I see some hands in the back.
I'm from the homeless community, what you're saying about the therapy, it's usually villainized as where something's wrong with us, or we have to be deemed an addict, or we have to be deemed, mentally ill. Instead of it just being, hey, this is a chance for you to get things off your chest. Like, other people go to therapy because they want to talk. But us, they make it seem like we're we get sentenced to therapy. So that could be a big gap in between that, maybe making it seem more of a helpful, or like not that we're bad people that we need therapy or we have to get assessed for something, you know what I mean? The only time we see a therapist is when they're assessing us for something. They don't make it like about our mental health, they don't really seem to care about that part. So that could probably help that gap a little bit.
Well, I can say this, I had this doctor ever out there that are scared to go to the doctor, like in the hospital and stuff, just because when they go in and they find out they're homeless, they're discriminated.
Yeah, once they find out.
You can't give me this service, or something like that, if you're automatically a drug addict or alcoholic, so they won't do the services. That's one thing we need to change, is that people need to go in there, to be able to go into the doctor or the hospital saying, hey, I'm homeless, and get the same courtesy that everybody else does, instead of being discriminated.
Because there are just as many addicts that are housed as there are homeless.
Yeah.
I know doctors, lawyers, attorneys, I've seen it all, and I've been out there in the streets come and buy drugs.
Absolutely.
So we're villainized for doing the same thing that the rich people do.
So what's your vision for what would be different?
Maybe just having, because you want to get help, you have to want help. And so a lot of people don't want help because they feel like they're just being treated like cattle, kind of just mass produced or mass assessed. Make it more individual care. Give people a chance to want the help instead of forcing it on them. You know what I mean? Stop making them that part of the part of the process to get housing. Let us get housing and then talk to our therapists.
And can I put you on the spot to ask you if you don't mind sharing? What makes Dr. MK like such a good doctor to you?
She understands, she's concerned about, matter of fact, I went in there, something happened to me, and she made me stay in her office for like 3 hours before I could even go anywhere, because I was all upset and depressed and stuff. She's concerned about our health than most doctors I ever met. She don't discriminate it, she understands what we're going through, she's out there to help it, she's not out there to get it.
And she sticks up for her. I've
Yeah,
heard
she sticks up for us.
I've heard very good things. Mom always says that anybody that gives her a hard time, you're quick to get on them for.
So Dr. MK is blushing underneath. But I think it's important when we, like in the same way we're trying to talk about what we want to see, when we see it, being able to name it so that we can think about how we replicate that for other people, because we want more Dr. MKs out there, not the people who made you feel as if
They definitely want to touch you. And you're putting gloves on and like doing all this extra stuff. You're not going to shake our hand or like, that is so discriminatory. Like when you walk in and they know you're homeless and they don't want to touch you. You're like, I wash my hands like everybody else. How many times have you washed your hands, anybody? Like, I mean,
To me, I can come to Dr. MK for any kind of problem I have, and he will not put me down for it. No matter what. He's always been there for me, so,
she finds solutions.
yeah.
appreciate that.
Family's kind of like that too. Family. Family put you in a box. Once they find out you got a certain injury or you homeless, oh hell no. Don't come over here.
It was really hard during coronavirus. Anybody that was homeless was automatically thought that they were carrying the disease. You know, most of us knew it.
Family.
You mean this at the door, like hi, and social distancing was way worse, but you got 6 feet, we got 12. It was crazy how stigmatized being homeless is. Like, it doesn't mean that we're dirty people. It doesn't mean that, we don't have a mother, or a sister, or brother, or a child out there. Like, they make it seem like we've never been a part of society. And that's, people are so wrong. Like, I lived the first 37 years of my life as quote-unquote normal. And then I was in a domestic violence relationship, and I figured living in the tent was safer than living in the house. house and I took to the streets, and that's where I've been since. Been about 3 years now, and it's been one hell of an experience. I've met some awesome people. I've met some rotten people too. I mean, there's always a bad apple in the bunch. But for the most part, I wouldn't trade the last 3 years of my life for anything. Because I got to know people in a way different demeanor. And I mean, than anybody would ever give me a chance to. I can walk into any homeless encampment, and the first week they find and get fed better than I would at some of my family's house. You know what I mean? Like, we come together as a community, like, it's brought blacks, whites, Mexicans, you know, every race. If we're homeless is our own race now. It's our own game. You know what I mean? It's like, it's not the color of our skin anymore. It's more or less, you know, our poverty or our economic status that, you know, that puts us in our own category. But I know that people have learned to get over a lot of different racisms and things like that, because when your neighbor helps you and you appreciate the littlest things, a gallon of water when it's hot, you guys, like, the simplest stuff you guys take for granted, like, it means the world to us. You know what I mean? Just getting some clean socks, you know what I mean? Like, people used to come around and get clean socks and gloves and things like that, hand warmers from the Dollar Tree. I mean, it's cold out there when it's cold. You know what I mean? Like, and some people just should, like, roll up in a ball and die. I mean, we've experienced how many losses? From
Just 2 in the last week.
2 in the last week, but in a total of what, like 100?
So out of 192, we lost 30 people.
Yeah, and just the last 3 years. And I mean, and they don't get funerals, they don't even hardly get picked up from the morgue, they don't, I mean, we don't even know what happens to our friends' bodies after they get taken.
We don't, it doesn't even pronounce that passed away or nothing.
Nothing.
We don't know.
It's like they never existed.
No, metanoid. But if somebody inside or somebody that has money and stuff, they get notice that this person got hurt or this person and stuff like that. But when it comes to a homeless person, it's all blocked out.
Like, even if we want to name our friends, because we're not next of kin, we have absolutely no grounds to do it. But do you know how many friends I've had to just worry about getting put in a mass grave somewhere? Or just burnt in a group? I mean, it bothers me. Like, their soul is gone, but their body should be, you know what I mean? It should have been treated better. And it's not. Like, it's so sad. Once you gotta kiss your friend goodbye before they go to the hospital, because you don't know if you're gonna see them the next time.
Don't know, yeah.
See, I'm in
That's
other
right.
camps, or my camp's head leader, I'm in South Sacramento. When everybody has a problem like her, he called me up, oh, something happened. So I try to get, like, one of our friends right now, he went to the hospital with COVID, he came out of the hospital with his legs rotten, now he has no legs, he's on the kid. They brought him out from the hospital back into the street. And
Like, the ambulances literally drop us back off at the encampments. Like, they're not even, and they put us out twice as fast as anybody else. If we had regular insurance or we weren't homeless, we could be in the hospital for 2 weeks, 3 weeks long, and we would be their chronic patients. But let them find out we're homeless or that we don't have a bed to go to at the end of the treatment, and they take us out faster.
Once
It's
they
like,
find out.
I mean, medication, like, we don't have transportation, but they'll prescribe our medication somewhere far off that we have to get to, instead of just getting us with it at the door. UCA Davis has changed that luckily. You can get your prescriptions before you leave the facility down at their pharmacy, but just the littlest things like that is why people don't get better, is because they can't get over to that pharmacy to pick up their antibiotics, or to have the crackers to eat with the antibiotics every day. Like, some people don't even know what day of the week it is, you guys. When you don't have a kid going to school or you're not able to watch the news Monday through Friday, you know what I mean? Like, people be like, what day is it? And like, well, I have to stop and look, and you know, you're like, okay, it's Monday, you know? Basic things like that get lost when it's a whole different world out there. It's like Swiss Family Robinson, you know what I mean? Like, some of the coolest tents ever, you guys, though. I mean, I've seen some of the most elaborate setups, and it's fun because I'm a camper. I grew up camping, so that's why the transition wasn't so hard for me. And I was like, oh, we're going to camping world, and I'm getting the best stuff while I'm out here. And you know what I mean? But so you gotta be kind of positive towards it. But it's funny to see the setups, but then it just all gets thrown away when if they need it. There's absolutely no honor amongst us at all when it comes to stuff like that, or the police department. Like, if you leave your stuff unattended, there's a chance that you might not see it ever again.
Ever, yeah.
And that is so heartbreaking to see women and children's stuff getting thrown away, and you know, like, there was an 80-year-old woman out on the streets this summer, and they threw everything she owned away, and she just had a mental breakdown just right there. And then do we get to know what happened to her? She didn't come back to our camping, so I don't know what happened to her.
Right.
And like, that kills me, like, the fact that we don't have faces beyond our situation.
What I want to see happening is more medical attention come out to the camp, because some of the people can't get to the doctor.
Okay.
I couldn't hear.
So,
Can you
yeah, so
repeat that?
I heard, I was trying to jot down, because you were going through issue after issue. Okay, so, I'm gonna back us up because I want to make sure that we stop, and I really want us to hear the challenges, right? And then also frame for us what you want to see differently. So, I want to go back to, you mentioned the stigma and stereotyping. I think we got some good things in there in terms of like medical care. Can we think about, we were talking about system non-response and like systems not being efficient in how they operate. Can we throw out some ways, right, that things could be different? I heard Janine say, and I can't remember now which session because all things start to bleed together to me, but Janine said something about like, you know, all these things are happening in the middle of the day, and it's very hard to be able to be at Mary House to get my 5-course healthy meal, and also be in line to get housing, and then be told I didn't, and then I skipped my meal, and nobody's around at 2:30 in the morning, but I had plenty of time to talk to you, right? So I'm just thinking, like, can we talk about some of the ways that maybe we could make some systems more efficient, so we can jot down some of like, what would we want to see there? And then I want us to come back down and talk about that and prescription access and information access. So let's start there. I see a new hand.
I think accessibility in general to health professionals and just like common places, normalizing that could be like a solution or something that I want to see in that sense. Like health professionals being on site, maybe like at Loaves and Fishes or like at whatever institutions, or just like realistically anywhere at the welfare office, but like just and like I heard outreach too, but like I guess in that sense of like you can call like a nurse line or something like that at whatever specific times, but just like the literal accessibility of having like them available in certain places at certain times could be a solution.
Okay, thank you. So we're hearing like putting people in places. I see Mr. Ed, and then I'll come over here to you, Rick.
Have them scheduled, have them come around at the times we're available. Or.
And what times might those be?
Like 2:30 in the morning, like.
Accessibility happening everywhere, all the time. Yeah.
Okay.
Well, it's so hot during the day that a lot of us don't stay in camps during the day. We
Right.
find refuge in different areas where there's more shade or where there's more access to cooling. So just there's night shifts at the hospital. I mean, why couldn't they make a night shift for us? I mean, if they want to have maybe a guard come around with them because they're scared of the situation. Most of us are just people out there, though, guys. I mean, it might seem kind of scary, but for the most part, we're just people. So just being able, like they said, when you said 2:30, you hit it on the head, because that's about the time everybody settles down. That's when it's like you finally get, you know what I mean, that people take that chance to get, you know what I mean, to actually be with their friends or their family that's out there, or some of the best conversations are had over the little campfire. Or, you know what I mean? It really is. It's like old days, like living. You know what I mean? Like homesteading. That's how I like to look at it. Like we're just,
I was just gonna sort of jump on what, I don't know your name, but what Cece said, that rather than having all these different, separated service access points, if those could be brought together so that if somebody needs a meal at the same place, they could meet somebody about housing or, a healthcare referral or, something like that, that would be so much easier and more effective. Similarly, when people are brought in to the emergency room for stuff, it always takes a number of hours. No offense, MK, but the emergency rooms. So that's an opportunity, to start establishing some relationships if there are social workers there, if there are, trusted, people to start helping to connect the services, and right? Or am I off base here?
So, you have to think about the reality that there aren't enough, at least mental health workers, to have a mental health care person 40 hours a week in every encampment. And so the question is, would it be better to have all the services together in one place that you had to go to? Or would it be better to have, like, the primary care doctor there, like, where you are on Monday and the therapist there on Tuesday and the, you know what I'm saying? It's like, which would work better?
I think honestly, in any extension, all of it, like to any capability that it could even be done. And I understand that you're totally right because they should just hire more mental health workers in general. Like realistically, like
Yeah.
why aren't you hiring more doctors and mental health therapists? You know, exactly. Like yeah, there's no positions and there's no exactly. So that's the messed up part. But also in the sense of like actual extension, any, both, all, right? Be where you can because it's like most definitely a high need.
I mean, one thing that may improve efficiency, I don't know, but like, is maybe like working in collaboration with the hospitals to open up like houses around the hospital to, like, for patients who need to use the hospital a lot, unhoused patients, like, that, actually what Marshall Hospital is doing now, they donated like 4 or 5 houses right around their hospital for patients who use the hospital a lot. And it's actually beneficial for both the patient and the hospital because like a couple of years ago, they passed a law where they can't discharge the patient back into the streets, right? So there's special rules and like it's expensive than like discharging these patients. So it'll help the patients accessing like preventative care and having to go to the hospital. It's very easy for them and it'll help the hospital maybe. But some of the healthcare systems like Dignity Health are not too open to the idea, but Marshall's been very open to that.
Is that true? They can't discharge patients?
No, they do it. It happened.
I was going to say, MK can probably answer this.
Yeah, there was like a SB, I forget the numbers now, you remember the numbers? No. Passed 3 years ago that like certain things are required by the emergency department before people are being discharged, including like offering of like I think it's HIV and hepatitis C testing, offering vaccinations, clothes, and a meal, and transportation to the person's choice. So there's not, it's not necessarily the hospital cannot discharge people to the street, but they're not required to provide housing.
Okay.
Right. Yeah. So, but they are required to provide transportation. There's like, it's a balance of like, you know, the right to not be held against your will, right? So it's, you know, it's complicated in that way.
Right.
Yeah.
Kind of needs to know if the patient knows about it though.
Right.
Yeah.
So unless the patient's actually educated to that fact, believe they don't offer those facts.
Right.
There's not a big old notice on the wall that says, we have to do this before you go.
Right.
You know what I mean?
Maybe we can make one.
Or how many people have been to, I mean, I just want to like, if you've been to the emergency department, did they ask you, do you have a
I
ride?
literally begged them for food one time. I was homeless and they wouldn't bring me a meal before I left.
Okay, so was this more than 3 years ago?
No, yeah, this was like last month or beginning of this year.
Oh, okay, so and there was no excuse for that.
The hospital here, you make a statement, a sign saying if you are homeless and you have nowhere to go after you know, be fair, you could be able to stay. Because nobody really knows, you know, like me, I didn't know at first that if you ask for a social worker, they can help you. Nobody knows about that.
Yeah.
Oh, Captain, did you have?
Yeah, I was gonna say something. They can release you without having a place to go if they don't got no place to send you. You know, them now, because they were gonna do me that way.
Yeah.
Then the next 2 days, a medical bed opened up for me. So they can do that because they ain't nothing, no place for them to continue to.
Right, it is.
Yeah. Okay, so we're talking a little bit about, you know, improving some of the non-responses or the efficiencies of the system. We also brought up death and grief and dignity, which is not on our list. So I'm really glad that this is why we have these conversations. So let's talk about what we would want to see happen, right? Both for the person who's passed away, as well as for the community of people who just experienced a loss. What might that look like? What do we want to see happen?
Maybe the person that actually calls 911 to report the body, having some right to check on that body in the process. You know what I mean? If we're out there within the homeless camps, we don't necessarily know everybody's business because people stay very private. But if I'm calling for my friend here, and this is the name I know of this person under, let me have some rights to at least, you know, if his family doesn't come to claim him, can I? You know what I mean? Like, I know that I've had a couple friends that it's just killing me to think that they just get put in a mass grave later, you know what I mean, after 3 months of sitting there, just in cold and storage, you know what I mean? It's just heartbreaking. Everybody deserves that same dignity as having some kind of ceremony or like if you forget about your loved ones, they fall out of heaven. You know what I mean? Kind of thing. And that's kind of like how these people just fall right out of existence, and we're not allowed to check on them. And I just don't see that they get any dignity in death. You know what I mean? Like,
See, in our area, it's I have everybody's information. Anything, I got the medical information, if you have any kind of allergies or something, I have their birthday, I have their name, I even have their next of kin. I can't even get this information to, like, somebody gets hurt or goes to the hospital or is dead. I can't even call them and tell them this person and this is his family.
Yeah.
They won't even let me get the information.
That's right.
so they'd rather put him down as a Jane Doe or a John Doe.
And I know all this information.
And yeah, my friend Han died in the hospital. He got COVID and was on a respirator, and God rest his soul, but like he was there alone for like those 3 weeks, and they didn't know who his family was. And we told it all. As he was getting in the ambulance, we were telling the ambulance drivers, you know, all the information.
And the phone number, all that.
Yeah, and the firefighters don't even take it into the doctor's office when they get there. So none of the stuff that he said from his own mouth was even documented. They were more worried about their hazmat suit and whether or not they were going to be contaminated. This was right when coronavirus was striking. And it kills me, like, you know, like, he didn't get a obituary, you know, like, and later on when his family found out, his family found out, but after the fact, you know what I mean, like, we should be able to do that for our loved ones. I mean, I don't know, we count, you know what I mean?
See, us three are from the same town.
Yeah.
Even though we're not together, we're separated, we make sure we know.
We do checkpoints, and you know what I mean, like, check-ins, like, I was out looking for her last night, you know what I mean, I put the word out, so she'll probably, when she gets home today, they're gonna probably tell her, oh, Kim was looking for you. And we've already been together, but you know what I mean? But I mean, we do have our pecking order as far as trying to keep tabs, but it's hard. We don't get any respect as a community.
I'm the one who goes out to, like, I have people from our camp that actually lives on the river, North Sacramento, Roseville Road, X Street, the State Ground, all the way around to Roseville Road, Elk Road. I go to every single spot and pick up on them all.
She actually needs more Ubers so that she can get there to get it. So if anybody ever wanted to donate Ubers, no. The transportation, our family structures. I mean, we're not blood related, but we are definitely family over the years.
I know over 30 people that from our camp that died. Only 15 got the name. The rest are under John Doe or David.
And then, I mean, we tell them their names.
You tell them their names, we're going to take out the name, and they want to take it into consideration.
Yeah.
So is there a legal way to do that? I mean, I'm part of it too, but would there be an easy way for the camp to give that to each other?
I don't know, that's what I was just thinking about over here.
Maybe an insurance on one of the encampments, like, maybe us to have our own government is what I thought would be a really good idea. You know what I mean? Like having our own garbage bin and our own, and having everybody, if you're gonna stay in the community, to put in some work. You know what I mean? Because nobody wants the bum in the corner that you know what I mean? Like has all the trash and the debris and all that. Let's work together and have that, you know, our own little community and our own little jobs, chores, and things like that, so that we're accountable for our own space. And then with that, maybe an entrance into the encampment, we can sign off on who's our buddy, our buddy system.
But the thing that, like the HIPAA laws are there to protect people, right? The privacy laws, but they also get in the way.
Absolutely.
In a huge way.
See, I can't
unfortunately,
get the people's medical history or something like that, but you should be able to call in and say, this is their family, can you please contact them here? Because that person instead can't give that information out.
well, you can.
They won't let you do
take
it.
it from us.
They won't take it from us. That's,
Yeah, and it's just
And there are questions about like how HIPAA extends after somebody's not alive as well.
Right.
That could be a loophole because HIPAA is primarily intended so that like people can't share information about you beyond, you know, the people that you want to have that information, right? The other side of that is that it's similar to how, like, if you pass out right now, like, if right now I needed to administer medical care to you, you would have to consent to that. But if you pass out, consent is implied, right? Because you're not the idea is you're not gonna sue me for trying to save your life, hopefully, right? And so, anyway, hopefully.
That's been like this weekend.
I saw the Incredibles.
I'm trying to North County.
Good movie.
I'm saying, oh my, like in North County, they're gonna kill me.
Yeah, it's not like somebody has passed, like, you know, you're in this, you're not, like, yeah, so when somebody has died, the idea that, like, we want to make sure that they're able to be treated with dignity would seem at that point, like, we want to treat people with dignity after they die, but also making sure that somebody is available to be able to collect remains and notify family and all those things would seem like it would hold a higher precedent. So I think there could be a way that we can handle that even before we can get into what we can do when somebody's alive and in the hospital, because those laws are still there to protect them, but
Well, a
that's,
lot of people that are homeless are already estranged from their families. So
Right,
they've got
right.
years for that in contact with people that are related to them. So at that point, I mean, they wouldn't even know to check on them. That's why missing person reports don't get made, things like that. You never know what happens to some of your loved ones, because after so long, they're an adult, they're allowed to disappear. You know what I mean?
Yeah, like this weekend when we lost Frank, that was everybody called me Frank. I'm the only one who knew his real name, because I ask everybody, I'm very organized, and I make them put down their real name. They sit in, after they had to fill it out. But the thing is, when I tried to tell the coroner who he was, he was no, we're putting him down as John Doe.
Okay.
Okay, luckily I knew his family to call his family and tell him, hey, he passed away. Otherwise, his family would never knew.
I saw Nikki.
I think Rose had their hand up before me,
Oh.
and
Okay, I'll go Rose and then I'll come back over here.
Thank you. I was just gonna say, I mean, when someone dies, it's really traumatic, right? And for the whole community. And so maybe if there was a way that whoever found out the person died, like at the hospital they died, then somebody could come back, like a liaison could come back to that camp or the place where they were and offer, I mean, counseling, some kind of support, right? 'Cause
Yeah.
grief is a real thing. And then in that same instance, maybe they, you know, maybe they find out if there's a next of kin, like some kind of.
Maybe the coroner themselves, or the one that come and actually pick up the body itself, maybe that could be done. Not the paramedics, not the staff like that, because they're already deceased, but maybe the person that actually comes to collect the body, maybe they can be the one that takes the collective information on who's the one that called in. I mean, just, and then from there, that could help, you know, I mean, as far as making it easier to, like, you know, to keep track of, maybe adding that particular, you know what I mean, necessity to the coroner's job at the end of the day. You know, it needs to have some accountability for whose body this is. So, I mean, that could alleviate the steps there. We wouldn't have to have a third person to do it. Maybe that's just something that they should do when they go out in general.
Yeah, so I see Nikki and then Captain and then CC.
I'm for Captain CC.
Okay.
Okay, nobody would want to be reliable for all that type of thing. You know, because then you got you like police reports, and then you got to go to court and testify. I don't know nobody want to do all that, be liable, then you got to go through all this information, you got to go through all this and that. You know, it just seems like it's too much to be, nobody want to do it.
So you're saying like one of the reasons people may not step in to help is because it's hard and it's complicated?
Very complicated.
Okay, and so would making that part easier make people more willing, or is there something else?
I would make them willing. You know, I didn't know that nobody want to do it because they say they're liable for whatever happened.
So we have to, so we get a next of kin without there being legal liability for that person, is that what you're saying?
Yeah.
Like, and maybe this is I'm really trying to strategize it because this makes a lot of sense to me. So maybe it's like, let's say I'm hospitalized, Kim is the person who was there when I'm hospitalized, and I say, I want Kim to be notified. Maybe I don't want Kim to make medical decisions for me, but I at least want Kim to be the person that you can share information
Oh, yeah, she got to go
about what's
down,
going
they can
on.
do that.
Yeah, but no liability, so like I don't have to decide, we're taking her off the ventilator, that's not, Kim doesn't have to have that on her. I can just be, that you let him know.
About it, you know what I mean? But if I do the right thing to call because I care about this person, like, that might be part of the police investigation if there's gonna be one.
Right.
Like, and then we just, maybe I can be the John Doe, and I just give you a phone number, and I can be Jane Doe, so maybe my identity can be masked.
Yeah.
You know what I mean? Like, it just, as far as I go.
Thank you.
That was
But I need to be marked out.
Yeah, I know that.
Oh, totally. I'm glad you said that because that was actually what I was that's what I was thinking of and what I was gearing for because I was wondering what it looks like at that point for an individual if they were like, if it was possible, and apparently it is, and then what it looks like if an individual were to be like responsible is like so if something happens or whatever, you're camping with the community or family, like how would that process look for people to like make their next of kin or whatever, you know, friend or family member, like have it be presented as an option if it is an option, and then like what it looks like, is it easy, is it complicated, and then for people just to, I guess because what were you saying? You said like there's a liability, right?
Liability.
The liability part, right?
Liability.
And so you'd kind of answer my question too with that one. So that's what
I don't know nobody really want to do that.
Right.
It's very complicated.
Yeah, I was really curious as to how that looks, but like what she said too, like when just like emergency context,
Yeah,
right?
like you're
Which are
emergency
like
contact, right?
totally
So-
taken seriously,
Yeah.
right? And then like maybe finding some way to just like present and like present that to patients and you know the general like this is a thing, this is a norm. It doesn't have to be a family member. It could be, you know what I mean, like making it easy or accessible.
Yeah, it's almost like maybe like an emergency contact, like a card. I mean, I don't actually know what the requirements are to be someone's emergency contact. Like, they just tell me and then I call them.
Right.
So I don't, like but if someone is nonverbal or like not able to give that information,
Right.
like what kind of documentation would you need?
Could it just be medical alert basic? Like,
Could it just be like a card with someone's signature? I don't know. I have lawyers here. I was like, what's like the lawyers?
Like a thought around that is we do so much documentation already, and like people have already really alluded to, like there's this document and that document and this certification to get to housing, and even just, and I know not everybody's in HMIS, and I know that the county, it's awful, but it's Homeless Management Information Systems, and thanks for asking, and I'm sorry, I'll try not to use that. And I know that right now one of the things that the like health systems and like city, county, continuum of care are talking about is data sharing, and how do they keep information, and how do they access one another's information. Because also, I think we've talked about before, but like, okay, you go to the hospital and then the shelter kicks you out because you didn't call them. You know what I mean? So it's like if they could have shared information. And then just thinking about that being a place where this lives. Like, why is every document about means testing me? Why isn't there this like you said the words earlier, advanced directive, but like why isn't there one of these documents on your file on me that is like what I want in the event of my like passing or getting sick, or like this is my community that I need to know these things about what happens to me. It seems like we could make that part of it. And it doesn't have to be like necessarily that like very overarching data system, but it could be. It's like a place that it could live.
And it does exist for people. It is just not equally, right? So like people come into clinics all the time, and I fill out their advanced directive, or it's really the PULSE form, which is, I forgot now. Physician's order for life-sustaining treatments is what it is, which is just like 3 questions. You know, what do you want? Like, would you want CPR? Do you want to be ventilated? Do you want artificial nutrition? And those are like 3 things that people make the decisions about, and that can be done like I could come out and we could do those forms, you know, out there. But then
go around with the computer. What is it that program you're saying?
Oh, the HMI.
They go through and they access their social security number, or they want our birth certificate. They all want us to do it. Maybe that just making that a questionnaire in that system just itself would help. Like when you have to be that way, time consuming as a doctor. If we got the lawyer's advice on how to do it and make it legal, but that would just be one more question system to make updated constantly. That would be a really good place to start. Maybe put an advanced directive or a next to kin like type of questionnaire.
That's a great idea.
I want to think about that.
I
Maybe
saw-
talking about hey, can't you guys like me, okay, and again, we always, as a council, always going to people that in our area and needing to put it on. Why can't we train us how to put that in the community ISM?
It's a good idea.
Because some people won't talk to them people,
Right.
but they will talk to us.
Yeah. Rick?
Well, I wanted to sort of change the subject a little bit. So I have an idea when I'm thinking about a lot of what we're talking about, isolation and unfair treatment, stigmatization, stereotyping. And this may be very naive, but what if there was like a acceptance, a code of conduct that we tried to get everybody in the community to adopt in terms of how we're going to treat our unsheltered neighbors? Just, I'm old enough to remember where it was very common to hear racial slurs and all kinds of things that are just socially unacceptable today. And so this would be a way to try to make, not shaking somebody's hand.
Setting community guidelines for the community.
No, really, it would be a way for people to, so, I mean, it could, I think it sounds a little corny, but it could really reduce the social isolation, because, and social isolation is a real driver of mental illness and all kinds of health problems. And you could ask businesses, hospitals, the city council, like the Sacramento Kindness Campaign is sort of an organization that pushes people getting along,
Yes.
I don't know, it's something that might, like if there were the 10 commandments of how we treat unsheltered people and posted on the wall everywhere.
Even like language, like what language?
Right,
Exactly,
yeah.
the same thing, yeah.
Yeah, because I think you brought up a really good point, and I saw a lot of heads nodding. Like, we're talking about culture change now,
Right.
in terms of the people not knowing, and so filling in that ignorance with some information. So.
Well, it could operate on a lot of levels, because if people adopted that, and then if you heard somebody make a statement at a city council meeting that said, all these people are, fill in the blanks, right? You could then call them out and say, no, our community values say that it's different than that.
Yeah.
Yeah.
Don't know how to make that happen.
Yeah, so I think NK got that down. Was there another comment?
Oh, I was just saying that I like that too. It kind of follows like the way this conversation has gone too, around like, okay, talking about barriers to health access. And those barriers have actually led us to this like pretty significant like early death crisis, where people just know so many people. So then we're talking about the grief that comes along with that, and thinking about the like lack of dignity that people are afforded throughout that process, and how that is kind of like, okay, well, we see that people are not given dignity, and that's a like main problem, and we know that does have to do with like classism and racism, ableism, and like some other things that we still have to like be working on. And so I think it is like, that idea of setting a standard and getting the community on board throughout the lifespan, and after death. And yeah, I think I appreciate this conversation so much, because I don't think there's been space to hold or talk about like afterlife.
Yeah. Absolutely. I appreciate everybody for bringing it up, so thank you so much. I think MK, you were next, and then I'll go to Susie.
Yeah. Just in line kind of with what both of y'all are saying, and y'all too. Something that I've seen a lot in the hospital, in the emergency department, and in the primary care world, in the hospital, healthcare in general, is how differently people are treated if there's someone else with them. Sometimes, like I've gone to the emergency department with folks and not said I'm a doctor, and people are like, yeah, it's like awful. Doctors are in health. Anyways, it's sad. And something I've been thinking about for a while, just in this like solution world, and we tried it before COVID, but like how can we create like a community of support to accompany folks to like hospital and doctor visits, and would that be helpful? And is that something that we can, you know,
It's,
yeah.
like, the voice.
I was going to jump in there and say, I'm going to tell a quick story of, I was rear-ended in a car accident back in June, so if you saw me in the back stretching, it's because my back is really tight. And I actually called my friend who works at UC Davis in the emergency department. Now, she's a pediatric emergency medicine person, but she's known there. I was in and out of the emergency department in and out. She was just my ride, like she was my friend. I was in and out in an hour, and I walked away and I went, I think I just experienced white privilege. I don't know if I can go back. The whole time I was there, people in the emergency department were like, are you comfortable with our course of care? Is there anything I can do for you? And I was like, no one has ever cared about how I felt. They were asking her there because she was their colleague, and this is a black woman. But because she was their colleague, suddenly it was different that I was being escorted to, and we were literally just friends. But because she was there and she works there, they treated me differently. And it was a real difference from how I'm usually treated when I get to an emergency department. And so what it makes me think of is that there need to be known entities to the staff who are serving as the navigators, when you brought that up, you know, serving as the people who are like accompanying you. So you get the level of care that they afford to each other because they do that for each other.
Yeah, we did this, we piloted something once, me and a couple of friends who were medical students, and it was just medical students accompanying folks, and like from into the hospital, into the emergency department. And yeah, I don't know, just thinking about it again now, as like something, you know, we were talking like short and long term, like what's something that we could do as a community like soon, and then long term, like work on some of these community guidelines, work on some of this stuff, etc.
So like something kind of like you guys are doing now, just like healthcare professionals, regular clothes, regular conversations, regular people, inviting the community, give them some tacos or something like that. But just like, you know, something like this, but you know, it could be even, it doesn't have to be super grand or fancy, but like, yeah, something just like very close, you know what I mean? So that people aren't overwhelmed or like feel afraid, like it's just like a person-to-person conversation.
Yeah. Like maybe do like a little block party to introduce everybody, you know what I mean? Like something like that. Like we're still people. So like how you said, like, you experience white privilege. With being homeless, it's like I said, it's our own different race. Like we get treated subpar as they know. Like my friend commented her, she did drugs per se. She had an aneurysm. She could have been treated with the surgery, but because she was a heroin user, they didn't do the surgery on her. Her life didn't matter. And they spent, why save her because if she's killing herself? Well, isn't it our business if we kill ourselves? I mean, everybody puts a toxin in their body. Everybody has their vices. Everybody has their things that they hold on to. How are those physicians able to pick and choose who they administer care to? I mean, my friend's mom died when she could have been saved. She was laying in her hospital bed for 24 hours after the aneurysm until she was irradiated. You know what I mean? And all they had to do was stop the bleeding in her head, but because she put a needle in her arm, they didn't help her.
I want to say when I went to the hospital, I was sitting in the waiting room for like 3 hours. When they finally made me fill out the chart and who your doctor and stuff is, when I finally picked and came in, I was back in the heartbeat. That right there makes me say, you know, I'm homeless. Since my doctor is in UK and everybody talks about her, when I went there, I finally get to go back in the room. That didn't make no sense. It took me 3 hours just to sit out in the room. And the aspect of NK, I'm already scared of doctors, I'm scared of needles. So she has to hold my hand and have me go. I'm gonna go. But they don't they make us feel unsafe. At the hospital where it's supposed to be the safest place to be.
I so appreciate this conversation, and part of the thing I've seen here that we kind of haven't talked about yet in a little more detail is maybe the information access that came up in terms of how people get information, and it made me think of, you know, COVID, monkeypox, like how is information, like what are the challenges with information access? and what are some ideas for how information could be shared in a timely manner, making sure the information is accurate, right? So we're not getting into rumors and things that aren't true. So I'm really curious to know if we have some ideas about what some of those challenges are and what we could do to be able to overcome them.
Maybe we'll attach a newspaper or a newsletter going out to the community. If we don't have access to TV, I mean, we're listening to, iTunes and things like that, we're not listening to the actual live television news. So maybe just once a week, maybe putting out a newsletter to the encampments and things like that, to let them know what the contagion things are, or what the exposure risks are, or things like that. Because technology is something that we can't afford when we're in these encampments. We don't have a power source that usually. I mean, some of us do. We're spoiled. We have converters and all that. But I'm just saying, as far as just getting the information out there in a platform that everybody could utilize. You know what I mean? Just a basic little. Homeless news or something like something that simple. I mean, if for free though, not something that has to be paid for because we already don't want to spend our money. That one little piece of paper though, the flyer might save a life or two. Or virtual doctoring. Why isn't there more? For COVID, we can talk to the doctor over the internet or online. Why aren't those type of booths set up at the places we go to eat or things like that? So maybe they can have a virtual doctor appointment. While they're at getting their other things managed, like things like that could help. I mean,
We don't read newspapers.
you better just get all over the place.
Most of the camps have leaders in them right now. They do have somebody that everybody trusts in their area. That when the healthcare bills come out or something happens to them, they should go to the camps to find out who is the one who is the one who leads. That's the thing. Like when the COVID came out. And Kay and Hart came to me and gave me flyers, and I passed it out because people say, no, that's going to kill you, they're going to distribute it to me. After I read the flyers, I explained to everybody, and I talked to MK, I went to the camps with them guys, I told the people to come and get the shot. Because before, nobody wanted the shot. Nobody except maybe 5%. I went around and explained to them, isn't it, MK? Yeah. You got the shots.
Yeah.
Yeah, you convinced me.
They need more people to come out and find the camp leaders and explain, can you do this, can you let people know this is what's really going on, this is what needs to be done, this is what kind of virus is going around and stuff like that.
Okay.
Because I didn't know about monkeypox till just now.
Any other thoughts on information challenges or information access? I'm hearing, the main thing is being able to have written, printed documents that are available that can be shared with people, not technology. And I'm also hearing trusted messengers coming up again in terms of like who's going to give it to you and explain it to people. Language access, that hasn't come up yet, but I think I heard again sometime earlier today. Also literacy, so just wanting to think about like, are there some challenges around both things only being available in English and then people not being able to access that, or things being written at too complicated a literacy level, and what might be some of the ways to address that?
Maybe, like in high school when you did your morning announcement, maybe in the camps we could have some sort of like intercom or something on a morning announcement if there's something serious going on.
Okay.
I speak with a lot of people that speak Spanish and they're just trying to Vietnamese, Lao, Long and stuff. What helps me without even tongue, because I don't speak it, is I've got a translator on my phone. It translates from English into that language for me to understand it. So the people that fill out the healthcare place should be able to have that translator on their phone, that it can be transferred, that the people understand it. I think they all need that.
That's rare though. That's rare.
What's rare, Mr.
Having some kind of device that translates some language into another language.
Every cell phone you do it now. Every cell phone with internet access, you go to Google Translate, it will translate any language you want.
And what they're saying back, what they're
But you
saying.
gotta know how to do it.
We're saying camp leaders maybe could go around and speak that.
Okay.
So most of us have our own language anyway. I mean,
Yeah.
there's like unspoken language when you're out in camps. I mean, people hold the water, you want water, you know what I mean? So it had to be something that was universal maybe, like,
What?
You haven't said anything. Why don't you-
No, go first.
Fine. What if there was like an information mobile kind of thing that, like a bookmobile, but that went around and it had computers and Zoom equipment so people could do remote appointments, you know, could rotate among different places, so rather than people going to the services, they could come there? I don't know.
They have portable showers, so I'm sure they could do something like that with computers.
Well, I mean, technically it's possible. Would it
Yeah,
be,
anything's possible this
would it
day.
be useful?
Yeah, I think so. I mean, I know that a lot of people would maybe do a virtual appointment if somebody would set up Zoom for them. Yeah.
Yeah, that's becoming more popular. Shower mobile, coming to people, coming to sites.
There's prices, risk reduction, they come around, or harm reduction, excuse me. They're amazing.
Yeah, they're coming around.
They're the most awesome group of people ever. You can go in and Narcan without any questions, needles, exchanges.
Yeah.
They're the most unbiased, they are so sincere. Like, I love the people at the harm reduction. Like, you're on Dr. Boulevard, like, they kick ass, excuse my language, but, like, they're saving lives by the hundreds, because they're putting the things in our hands, like, I can save another life, because I keep Narcan on me. You know, just because there are so many different people of all walks of life too are getting overdoses right now. Pill poppers to rich to the poor, it's an epidemic that's hitting all of us harder than even COVID. I mean, and just arming us with the thing to save those lives is amazing without any questions asked.
Yeah, harm reduction, I was mentioning harm reduction, they came up with hygiene kits, first aid kits, prior to everything for us.
I mean, they get it as, they're as detailed as getting, like, cold medicine that's okay with heart problems. I mean, it's all for free.
Yeah.
Nothing, I mean, you go to get chapstick, I mean, sunscreen.
And counseling.
Yeah, I mean, condoms, I mean, so that people can go, I mean, it's really good, it's all fascinating, like, anything harm you go. They really are great people.
So I know we have a comment here, and then I'll go over to Diane, so.
I just want to say a more solution-wise with information access. There are different generations of folks that are unhoused right now. So technology-wise, it could be bad, but that's the only free available information. So like social medias would be a solution provided regarding on like informations. Another thing I've seen in Oakland, where there's this encampment called Cobb in the Wood. They have a bulletin board, which is beautifully made, but they would get informations there about the updated policies about, you know, anti-homelessness. Things are informative that the community around it can actually go in, where they can check it out. Right next to a community kitchen table or area. So it's easier access for folks to come in where it's a community-based kitchen, and then they can actually look at the bulletin. So I saw that culture, how they were doing that process. Regarding on social media, there's a lot of folks that are really tuned into Facebook, Instagram, TikTok, all of these things. And I think there needs to be a better way of amplifying these informations that's gonna help the folks that are unhoused to really be updated on what's gonna happen to them with these policies that are about to come in, to if there's any resources that are available temporarily so that they can actually have some kind of game plan. And I know for a fact that their schedules are not the same thing as a 9-to-5 job, weekday folks. And so they are available on the opposite side of that. So I think timing wise is also another way to informing folks. I think that's what I have so far.
Thank you, we really appreciate that. Diane?
So, the issue of what happened yesterday, I was talking to a friend who's a social worker in a hospital, and like someone walks in and she doesn't know that that person actually was seen in a different hospital the day before. And then so I want to segue into this sort of issue of what the hospital is supposed to provide, because she was telling me that she will spend that she's required to make phone calls to find shelter for people. And then when she finds it, they have the right to refuse it, but she has to find it first. And it just seems so sad to me that like she's reinventing the wheel when there should be, you know, coordinated access to services. She should be able to just say, okay, here's the person who knows where all the shelters are and where, you know, all that, rather than her having to call every single shelter. And then, like, I don't know how to, we were talking about when you walk into a hospital and you're treated badly, but what I hear from some providers is a sense of people coming across as entitled. And I wonder if those, if there's a way that those two things get tied together, that I don't know, when you like walk in and expect to be treated badly.
Yeah, I mean, I think we have to start in the place of systems, right? We have to like acknowledge that classist stigma is first. This isn't a chicken or egg question. It's existed, it's part of the organizing principle of our society, and that includes hospitals. You know, hospitals fought to not, white hospitals fought to not have black patients. You know, they've always had, it's always been a struggle to have an inclusive healthcare setting. And so that started first. And so people, and I think, I didn't quite hear a little part of this, but like, I think the idea on the other end is like, what are people are, yeah, now at this point expecting to be treated very poorly. And then there's misinformation about like laws or like what's required, right? Like particularly with this quote hospital dumping law. And I think what the nuance is there is that they have to try to get shelter. They don't have to get an offer of shelter, they have to try, the social worker has to try to get shelter. And I'll say that the social worker's job is to do those calls, is to know the shelters. That's, I mean, we went, you know, to get a social work degree, you have to, that's the goal. You know, you familiarize yourself with the resources in the community and you help people get to them. But I think, yeah, I think it's just important to recognize that she's running into the same problem that every social worker, everywhere, you know, every navigator, every outreach worker, is that run up to, there aren't the things that we need, that the people need. And so, just, you know, here I'm going to talk about it a lot, but if she could just prescribe housing, actually, that would be great. And that would be, and that's why I think that law is trying to get at, and what that like workaround is for people. But anyways, it makes it so also people come into the hospital and, like we're talking about information, just may not know exactly what's required, but they do think the hospital is not supposed to just put them back out on the street, if they know. And so
Hospitals do it anyway.
I was like, I mean, I think Nikki, I'm sorry, I had to step out for just a second. We have about like 15 minutes left. But I wanted to follow up on your question, because do you know, or do you have some more detail? I know you're relaying the experience of a friend, but when you say entitled, what might that mean?
So I've heard things like an unreasonable expectation, like, oh, well, I want housing, but I want my own house with a backyard, but I don't have any income to pay for it.
Okay, and the reason why I was, kind of curious is because I know sometimes when people have been fighting for things, right, and having to fight for everything that they do, that there is a way that's kind of the like attitude you have to bring to things in order to get them, because we were talking about some of the like stereotyping and the stigmatization and all of that, of like, I'm gonna come in here, it's like all my life I had to fight, right? And so I come everywhere and I'm kind of fighting for these things, and I'm telling you this is what I want. But I also think that, and not necessarily for this conversation, But I think we need to have some future conversations. I know we've mentioned health, you know, housing as a human right. We've mentioned safe and affordable housing. But I think when it comes to, you know, measures like Measure O and things, the question constantly comes up of like, what is acceptable housing and what is acceptable to say, no, I don't want that because that's not meeting my needs. And I don't know that there's, you know, a community agreement around that, right? Like for some people it'd be like, if I throw you into this tiny home that's 5 feet by 5 feet and say there's a roof over your head, that I've done what's necessary. And for other people it would be access to natural light and in a good space, and I can have my dog and I can do all these other things. And so I think sometimes when I heard the word entitlement, I was really curious what that person might have meant, because there is this question of like, if we're talking about human rights, what am I entitled to? Like, entitlement is framed in a negative sometimes, but it's also just you saying, these are the things that I deserve, and I'm unwilling to compromise on them. And so going back to, you know, our original framing, are we not allowing some basic human dignities because people are unhoused? Are we not allowing people to have a beer at the end of the day because they're unhoused, right? Are we not allowing, it's the same way we pull these poor people around, why do you have those Jordans? Well, maybe my aunt bought them for me because she felt bad that, you know, we don't have other things, right? Like, we don't know where things are coming from. Or maybe I thought this was important to just make my kids smile for a few minutes, like, right? Like, we're kind of policing people in this way and what they're allowed to have and what they're allowed to want. So I'm curious how those attitudes get infused into our institutions in ways that then make us feel a way when certain patients advocate for themselves or say this is acceptable or is not versus other patients. So I just wanted to kind of bring that up as like part of our framing of like, let's question that a little bit. I don't know if there's a right or wrong answer, but let's question it a little bit. Let's see a few hands.
This person got that person over there got that, I didn't get it. What's up with that?
Yeah, I mean, but maybe that's unfair treatment. Maybe it's, you know, maybe there's other things going on.
Maybe,
right?
yeah.
I saw a new hand over here, and then I'll come back over here to you guys.
I was kind of wondering, is it men? If you could speak to like how telehealth has been accessible or inaccessible to the unhoused community, because I was just like wondering, like, is technology access a real issue? Is that something that actually makes healthcare more accessible?
I hope everybody's trying to get it out and for that stuff. There's a lot of people there saying you have the access to get it. Like, I don't have my phone, I used to be able to just go on our laptop or something like that. And we all keep it to community together.
Okay.
And I'd like to bounce off of that as well, because I would like, as well as observing it. For me personally, I'm just like one human being, and I'm unhoused too, so like I navigate everything like by myself. And in that sense, absolutely. Like sometimes like literally I'll go out of my way just to go get like literal Wi-Fi, literal phone contact, phone dies at work or something, I'm fucked, right? Yeah, totally.
And do you feel like, I guess, your conversations with the providers have been just as like, I guess, productive through telehealth?
Yeah, absolutely. I mean, like, literally, that's like one for me personally too, in that sense. Like, to have that connection.
Okay.
It's like very important to me since I am just one person by myself. And like, I don't have that community. So, yeah.
I was gonna say, a lot of people want to be independent. You got to find what that person goes on. They want to help them find a place where they can camp. If they want a job or if they want housing, everybody don't want the same thing. That would kind of split people up and have people going in all kinds of directions. You got to find out what direction you got person going, what you really want to do.
I would say the calling driver we have then is like Molina, Blue Cross, Mercy, whatever like, group there is for healthcare. They need to make a contact. They come out and do the camp at least once or twice to let people know what's going on and give you guys classes and medical advice and stuff like that. I want some more television guys coming out and doing that.
You want the health plans, like Molina, River City, and
I want them all, if they're going to have this group, to be healthcare and get paid for it, because people who are homeless are mostly on Medi-Cal and not on Medi-Cal. So come out to the council and let you guys know what's going on with their life, and have classes like you guys used to do, first aid classes, ORCAD classes, CPR. I want to see more of that to happen in the county.
Okay.
That's interesting. I don't know if everyone in this room is aware, but California is right now in like a pretty big state of Medi-Cal reform. So there's like a lot of changes happening right now with Medi-Cal. A big one for Sacramento is like decreasing from like 5 plans to 2 plans plus Kaiser. And so there's going to be some transitioning from plans there. And then they're supposed to be offering enhanced case management services, but I don't think, like, no one's really figured out how to do that yet. And so how are the health plans going to be able to offer these services and get people enrolled and let them know that it's available? Kind of like what Kim was saying earlier, like, people have to know it's available in order to offer it. Everybody, your health plan is going to now start offering.
And I also, on top of it, pharmacy and stuff, I like to see more people doing like Med-Aid does, that they come up to the camp and deliver your medicine.
Yeah. Yeah, for Med-Aid. Yeah, for Med-Aid. Yeah.
And I think one of the other things that we also have to keep some attention to as the Medi-Cal reform is happening is also the funding for community health workers. Because I think a lot of what has been discussed here today, right, that the promotora and community health worker model should be extended, right? So instead you're operating essentially as a community health worker or a promotora in your community, and so you should be paid for that. That should be something you're trained to do. That should be something that you get resources to be able to do, and so you're not just doing this on your own, but you're actually serving in this officially and helping to do that because you're already really well positioned to do it. And so those are the kinds of things that as things are changing and as these new policies are coming out, what does that mean for how we, I always tell people, like, there's all the work you do to get a law passed, and then there's the actual stuff of implementation. And there's a lot of decisions that get made and how things are implemented, that it can be implemented really well or really poorly. It can be, and there's a lot of decisions that can be made that you don't have to go back and ask elected officials to make, that the people who are just hired and are doing this work can make on their own. And so there are some of those decisions that I think can be really helpful to influence as well.
Yeah. Good. It's a great.
So, well, we were given the 10 minutes 10 minutes ago. So that looking at it was 3:13 and it's now 3:23. So I think we wanted to wrap up. I think the remaining, they said by about 3:30. So the remaining question that we just wanted to have is like, what are some of the remaining questions that you have that you would love to have answered as we move forward?
So we're talking more information about medical and health that can pass out to parents.
Yeah, like about medical conditions.
Yeah, anything that people can be more knowledgeable about what's going on.
I think it would be helpful to get out into communities where neighbors, like, they don't know what to do, but to help them understand that, like, go give the camp water or go give people hand warmers, like really small things that we can tell our neighbors to do so that they can feel like they're helping towards solutions.
Yeah.
I come from perspective of like patient advocate because we work in the Willow Clinic and we work directly with our patients. We want to make them feel as comfortable as possible, but we talked a lot about how there's kind of a mistrust of anyone that's in the medical clinic, even if we're not doctors or medical or anything, we're just volunteers. But I'd like to know how we can build that trust, how we can really like communicate and build a bond just as a part of the community instead of just making it seem like we're here to fix your problems and then just discharge you. You know, what can we do to make you trust us?
You know, trust for nobody.
Like Dr. Kidd, don't worry, you have to keep on coming to see how that person is. You just can't come 1 or 2 times and forget about it. You got to constantly time and to build up that trust.
Exactly, and sometimes like you do try to call back, but obviously there's going to be issues like not having access to phone or any electronic devices, or not having transportation to come back to the clinic. Like these are all issues we really need to think about when we're trying to build that connection with our patients.
I think I have another answer to that. So I think with my experiences, there are folks, there are different human beings that folks like that we've entrusted and had personal experience with. For example, I've known Betty since like 2009, and with that delegation, like you can get in contact with those people. Like, hey, I know you're close contact with them. You see if you can have communication with them.